Hi guys, this is my 2.5 week update after surgery. Sorry that I have been so out of the loop. Part of it was having my mom here. Sorry, I don't know where to look. I'm using my tablet. I think the camera's up here. Maybe not. I don't know. Anyhow, my mom was here, for 2 weeks, and I didn't do a whole lot while she was here. She was taking care of me. And then she left a little over a week ago, actually a week ago this morning. And things have been improving. I can say that. Don't remember, I think I said on my last update that I was given a spinal block and a thigh block before the surgery as my anesthesia, and one of them wore off completely by the time I woke up in recovery. Yeah, I was in a lot of pain. My first week at home, was it my first week at home or my second week at home? A lot of pain. So, I talked to the doctor's office about what options I had for managing my pain. And once I did that, I felt like 1,000 times better because I felt like it was in my hands and that I could manage it. So what that means is that they had me on the lowest dose of oxycodone, which is 5 milligrams. And so what they had been giving me in the hospital was 7.5 grams of oxycodone. So why they sent me home with less for a prescription for 5 when they were giving me 7.5 in the hospital, I don't know. But I still have a prescription for 5, but what I do is that, when things are especially bad, and that's usually at night, I'll do a 7.5 dose, and then I'll go back to 5, and I'll do a couple 5s, and then when it gets bad again, I'll go up to a 7.5 dose. So, I just manage it by only going to the higher dose when I really, really, really need to. Because along with narcotic pain medication comes severe constipation. And I thought I had known what constipation was before now, but I did not. So that has been an issue all along too. Anyhow, so yeah, I'm at the point now where I can feel most of my leg. Stuff has worn off. I can feel my entire foot. I can feel my hip, my thigh. My thigh is horribly bruised, just like, looks like somebody beat me and left me for dead on the side of the street. And that is partly, they tell me, from the from the tourniquet that the surgeon put on during surgery to keep me from bleeding. And it goes right across the middle of my thigh. And that did all that bruising. And then I have to wear these I don't know what you call them. I think they called them Debs. They're these really, 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 really strong stockings that are to avoid DVTs, blood clots, and that. And so those hit me exactly where the tourniquet hit me. So yeah, pain from that. But my bruising from the tourniquet is finally starting to go away. So that's good. What else? I had my 2-week follow-up with the surgeon this past Thursday, the other day. There were 3 things I went in wanting to hear. One, that my recovery was going fairly well, at least fairly well. 2, that I could take these freaking stockings off. And 3, that my baby could come home. Because you may know that I found out towards the surgery that They consider pets to be a bacterial risk, and therefore I was not allowed to have my baby in my home from the night before surgery until 2 weeks after surgery, and even then only with the surgeon approval. So here's how we came out. Number one, I was told that my recovery is going well. I'm not necessarily the head of the pack, but in no way am I in the back of the pack. And my surgeon was being very closed mouthed and giving me great praise or anything, but he had only seen me that few minutes. But my at-home physical therapist, he gave me praise constantly. He said, "Oh, Miss Sharon, you're doing so well." And every time he came and I did something that I had never been able to do before, he was just clapping and congratulating me and said, "Give me a high five." So that was a good feeling, that he was telling me, "You are doing so amazing." So, okay, so I was told that my recovery was coming along fairly well. I was told that I could take the stocking off of my non-surgical leg, but that I really did need to leave the surgical leg stocking on for a while longer to make sure I had no blood clots. And I thought, really, the day that I was being driven to my doctor's appointment, I said, I don't think that I can live much longer with this stocking on my right leg. I think I'm going to take, desperate actions or something. It was that bad. But what I did is I just reframed it in my head. I know someone, I don't know if she wants to be, her story to be spoken or not, but one of my YouTube friends, her husband was having a knee replacement around the same time as mine, and he has had a horrible, horrible time. He's been in the hospital or the ER a couple of times since surgery with blood clots, and he's had a horrible time. So what I decided to do was just reframe it in my head. I used the freedom of being able to take the left one off as my celebration. Yay, yay, I got my stocking off. And then I just stopped even focusing on the right one, about how much it hurt, about how much I wanted it off. I just stopped focusing, and I told myself how blessed I am that I am not having blood clots. So, I'm just wearing the stocking and just plowing on as best I can. So that's where that positive mindset comes in. When I was going to the doctor, I said, I can't take this one more minute. I really cannot. I'm going to hurt somebody. And then coming out of the doctor, and I had already heard from my friend here on YouTube and what had happened to her husband, and I just decided I just need to reframe this so that, taking the one off the left leg is a celebration, and the one on the right leg is no big deal. So, and then the third thing was, can I bring my baby home? And he said yes. So my baby came home the night of my appointment or the night after. I can't remember. And oh, she was so excited, and I was so excited, and she just jumped all over. Well, of course, that's not good because, it's very, very, very painful if she comes anywhere near my surgical leg. So, I'm teaching her that I have a boo-boo leg and a good leg. And she's allowed to come up and approach me on my good leg, but not on my boo-boo leg. And when she wants to get up on my lap, she's always come up from the right before, but now she has to come up from the left to get on my good leg and not my boo-boo leg. So we were taking a nap earlier in my recliner, and she got up on my lap, and, she learned to jump up on my good leg, and she kept herself completely on my good leg, and that was good. So she's out being walked right now by the dog walker I hired. And so yeah, life is great. I'm doing well. I will say that it sucks being in the house all the time because my right leg is the one that got operated on. I cannot drive for 6 weeks after surgery, and I'm only at 2.5 right now. And so, yeah, But, you know, I have people who can take me out to the store. In fact, I have people who've already gone grocery shopping for me, pick me up things, and then I just pay them when they get here. But I've had people offer to just take me out and drive me around, and it may come to that because it's really boring. And I go out for a walk every day to the mailbox that's at the end of the road, and I take her for a little potty walk, and then I get the mail. So I guess that's about where I am. I don't know when I will start making videos again in terms of makeup videos and content like that because I cannot sit at the computer yet. I cannot bend my surgical leg enough to sit comfortably at the computer. And on election day, I had to sit there and get my absentee ballot straightened out. And I was in agony from just forcing myself to sit there, even if I had my leg up for part of the time. It was just agonizing because there was no good way to sit at the computer. So it's just hard to say. Right now, my day is mostly having a little bit to eat here and there, having a good nap here and there, doing my PT, and oh yeah, I'll be starting external PT on Monday. My home health nurse and my home health PT, they're done now. And on Monday, I will start with 3 times a week regular PT that's going to push me a lot harder than this dear man did that I've had here at home. Oh, what a dear, dear, dear man. He was a little, slight Asian man. And he just had this amazing, positive attitude. And he would be like singing while he's trying to get something out of his briefcase. He was just really dear and very sweet. So yeah, I'm not looking forward to Monday where they're really going to start pushing me because when my leg gets pushed past the point where I can bend it, it hurts. So the doctor recommends that I take my pain medication, try to time my pain medication for 1 hour before I'm going to PT. So let's hope we can do that. Okay, we're at 12 minutes and 34, 5 seconds. So I'm going to shut up now. And thank you, oh my gosh, for continuing private messages and public messages and for continuing to watch my videos and leave comments. Thank you so much. And I've even continued to grow my channel. I've had subscribers actually joining while I've been off. And I'm just so touched by the love and support of YouTube. So thank you so much. I just want to give a special shout out to some people who have just constantly been contacting me and saying, "You all right? You all right?" And that is Susie Q, who was previously went by Glitzy Girl and Glitzy Grandma, and also Mrs. Loretta. Thank you, ladies, so much for just continually checking in with me. Even when I was in the hospital, I was able to, send a message back. So that was great. All right, dog walker should be back here soon, so I need to get off of here. Take care, be well, and always be yourself. I love you.